Hi, I'm Adam Blaine. I'm a second-year resident here at the University of Iowa, and I'm interested in the global health opportunities here with the internal medicine residency. I first got involved in global health prior to medical school. I did a lot of traveling internationally and developed a broad perspective of different cultures. And that's what interested me in healthcare in a global setting. At the University of Iowa, during my interview, the program director, as well as other faculty, brought up the opportunities in global health, and that's something that appealed to me. I was able to reach out to the administration of the residency program, and they were able to set me up with a global health elective. They put me in contact with Dr. Blount, who has extensive experience working in rural, underserved communities as well as internationally. His experience working in Southeast Asia as well as in Africa was something that we discussed together, and he was the perfect mentor to be able to responsibly complete an international elective. Gauging those interests, he was able to help match me up with a community in rural Uganda. I was able to set up a rotation that offered a resource-poor setting outside of the metropolitan area, but I'll be working with an academic team in a responsible manner. It was important to me that the global health experience offered responsible stewardship when it came to experience internationally. I'll be spending most of my time working within a team so that the resources that we provide are sustainable and adequate for the local communities. During my experience, Dr. Blount has offered the opportunity to work on research that he's been conducting internationally. So I think that offers a great blend of experience, both scholarly as well as clinically when I go abroad. One thing that's important also about an international experience is that you really get to know the communities that you're working with, and I think Dr. Blount has that expertise because of his connections around the world. While we go to Uganda, I think it's important that we kind of acknowledge what their local customs are and some of the ways they treat healthcare conditions, and we can incorporate that into our practices there in Uganda as well as back here in the United States. One of the most important things that I wanted to get out of this experience is using some of that knowledge in a resource-poor setting that I could utilize here in the United States as well as when I go back to practice in rural areas. And I think having that opportunity in an international setting gives you great perspective while meeting the locals, and then being able to bring that back here and really offering the diversity of experience.